Good afternoon, everyone who is watching this webcast now, and also to people who are going to join it later. So today we are going to discuss a synergistic approach to attain optimal clinical results in acne scars. Now, you all would agree with me that in this era of selfies and social media, everyone wishes for a clear skin. So what happens is there's a more inclination to get the acne scars treated. And this comes with a clause, the need for treatments with minimal downtime and substantial results. So you have to deliver results. At the same time, no one else should come to know what is happening on your face. So you have to have treatments with minimal downtime and giving substantial results. Let's see if we can do this and we can deliver results. You all are aware of the different types of scars. We have the deep rolling scars, the shallow scars, the box scar, then the papular scars. So you're aware of all this, but all these scars, we were actually considering them as sebaceous hyperplasia till a long time, until recently a paper on papular scars was published, which clearly tells that these papular scars are not sebaceous hyperplasias, but they are cobblestone-like papules, and they are basically the exophytic acne scars. Now let's see what is, so today we are going to discuss about Praxis Duo. So what is it? It's a combination of microneedle radio frequency, a fractional CO2 laser, and also a surgical CO2. So let us see how we can combine both of these treatment modalities to deliver optimal results to our patients with acne scars, open pores, and active acne. To begin with, we should know what is radio frequency. So, the principle of radio frequency treatment is that the radio frequency waves enters the skin, then there is resistance by the skin tissue, and this leads to generation of heat. So, ideal heat which needs to be generated in the dermis is around 55 degrees Celsius, and the ideal temperature is around 100 degrees Celsius. So this fact offers the greatest resistance, and it also depends upon the characteristic of electrode, whether you're using a monopolar radio frequency or using a bipolar radio frequency. And in bipolar, the type of the needle used, whether you are using insulated needle or non-insulated needle. The immediate effect of radio frequency is that there is collagen denaturation and fibril contraction. So immediately you get a skin tightening effect. The delayed effects are because of the inflammatory response that is set in, which results in neocollagenesis. So this gives you delayed skin tightening. And in the long-term effect, because of the neocollagenosis, the inflammatory response, the development, the multiplication of the fibroblasts and the remodeling of the collagen, there is also tightening of the fibrous septae in the subcutis, and it gives you an anti-sagging effect, and it also changes the contour of the face. So conventionally, we had monopolar radio frequency and bipolar radio frequency. So the monopolar radio frequency, the problem with monopolar radio frequency was that there was risk of epidermal burns. So epidermal cooling was required. Then there was unpredictable delivery of the heat due to varying tissue impedance. You never know the depth of the penetration of the heat. And there was a lot of pain and discomfort involved in this procedure. Then came the bipolar radio frequency. The problem with bipolar was the effect was superficial because the depth of penetration in bipolar radio frequency is just half the distance between the two electrodes. So whatever intensity you were using, whatever energy you were using, the depth was very superficial. So to um, improve the results given by monopolar or the bipolar, and to manage the challenges which were given, I mean, which occurred because of monopolar and the bipolar, the shortcomings. To address the shortcomings came into being the microneedle radio frequency. So it all began with the divide and rule technology. So the fractional techniques were first described by Mainston and Anderson way back in 2004. Since then, it has definitely revolutionized the procedures of aesthetics. It led to development of fractional lasers and, of course, fractional radio frequency. So what is fractional microneedle radio frequency? So it's a novel method that allows non-thermal penetration of the epidermis. So the needles penetrate the epidermis non-thermally. It it doesn't give heat immediately upon penetration. So this is followed by, when you press the trigger, it is followed by radio frequency coagulation in the selected depth of the dermis, surrounded by a non-coagulative volumetric heating. So this array of needles gives us zones of thermal wound alternate with unaffected epidermis, which causes remodeling and rejuvenation of the skin. So it is like we are giving controlled trauma to the skin, and it causes regeneration of the skin, thereby giving us the improvement in the texture and the contour of the skin. So what are the types of needles used? It can be insulated or it can be non-insulated. Insulated needles are open only at the tip. So what happens? It is delivering energy only at the tip, which is exposed. So only the 20% of the needle is exposed in insulated needles. So there is coagulation and denaturation, as we discussed earlier, but it is not delivering energy to the entire depth of the needle. It's only at the tip. Whereas in the non-insulated needle, you can see it is delivering energy right from the tip to the base of the needle. So whatever depth of the needle is inside the skin, it is giving the heat energy. The thickness of the needles can vary from 200 to 300 microns, and we have this needle cartridges in different sizes. So it can have a 25 by 20, 25 needle cartridge, that is the 5 by 5 cartridge, or it can be also 49 pin cartridge, so it is 7 by 7, and also 10 needles in a single column is also there. So these are the different type of cartridges which are available. Now, what are the shortcomings of insulated needles? As you can see, because only the tip is delivering the energy, there is low volume of dermal heating, there is lack of effect in papillary dermis, and there is pinpoint bleeding during the treatment. And you might have to target the epidermis separately through sublative radiofrequency. When we plan a procedure, we need to take certain pre-treatment precautions. So what you are going to check for dryness, because most of the problem starts with dry skin. Now, in this case, if you see, you can see there are a lot of red patches all over on the forehead, on the cheeks, and also on the chin. So it was basically a dry skin. We applied topical anesthesia and occluded the skin. And when we removed, it was all red and raw like this. So this is the most important step in doing whatever procedure, not only microneedle radiofrequency, whatever procedures you are doing with topical anesthesia. First, check for dryness. If it is dry, apply moisturizer and then put the numbing cream, and then don't occlude it. Check for sensitivity to topical anesthesia. Just ask a history whether you had done some procedure and you had, though it is rare, we need to check on it, because then the patients might feel that you did the procedure wrong, and the patient should be well hydrated. Well, the downtime in fractional radio frequency is very less, but although minimal, you should align the patient that you need to take care for another 4-5 days. in terms of avoiding exposure to sunlight and all that routine care. Then preparing for the procedure. As for any other thing, the informed consent. Please take the pre-treatment pictures because things happen that patient said that I never had this scar on the nose and it's only after the radio frequency that I got this. Then you can show the pre-treatment pictures that it's already there. So this happened with me once. The patient came saying that I never had this scar, doctor, and then when we checked the pre-treatment picture, it was always there. So it was like, oh, maybe because of the treatment on my cheeks, I'm finding it there right now. Always take pre-treatment pictures and see to it that they are clear because first picture is the best picture. After second session or the third session, if you are taking, it doesn't hold that much because the results would have definitely changed the scars or changed the texture of the skin. Then apply the numbing cream. After say half an hour, 45 minutes, remove the topical cream and prepare the area of interest with wiping it off first with spirit, then with betadine, and then again with spirit. You maintain strict asepsis and then no problem occurs after the procedure. So what happens in microneedle radiofrequency? The microneedle cartridge is placed on the skin surface. It's always better to stretch the skin and then place the cartridge so that the depth of penetration is optimal. Then the microneedle penetrates inside the skin only when it is penetrated completely to whatever depth we select. The bipolar energy is applied to the target tissue. Then the needles are taken out and the collagen regeneration and the new elastic production process begins. So what are the parameters we should look for or keep a watch when we are doing the treatment? So if you remember these pictures, things are very simple and easy. First is the intensity and the duration. So if you are giving less intensity and more duration of time, there will be a lateral spread of the energy. So you can see the circles are bigger and they are overlapping. So this is what we need in acne scars. We need the energy to be spread laterally so that there is more coverage and useful. It's very useful in treating the acne scars. If you are interested in tightening of the skin or lifting of the skin, then you will use high intensity and low duration. So what happens is when the time of exposure is short and the intensity is high, you can see the depth of penetration is more and the lateral spread is less. So this will help us in more of tightening and lifting of the skin. Now selection of the depth of the needle. So we can select the depth of the needle from 0.5 millimeters to 3.5 millimeters. So depending upon what you are treating, you can adjust the depth of the needle. So here in case I'm treating the acne scars, so it can be anywhere between 1 millimeter to 2.5, 3 millimeters, depending upon the thickness of the skin as well. If I'm treating the body for stretch marks and hyperhidrosis, I would definitely keep it between 3 and 3.5. If I just want to do the pore minimization and all, then even 1 to 2 millimeters is good enough. Then the number of passes. Now, since we in Praxis Duo, it is the non-insulated needles, the energy is given to the whole depth of the needle. So even if you do a single pass with right energy, you are going to get the results. But if you intend to tighten up the skin, you want lifting of the skin, then it is advisable that you give 2 to 3 passes. And passes are done along these vectors if you are interested in tightening of the skin for facelift or skin tightening. Then how to choose the appropriate depth? You always feel the thickness of the skin and start from the lowest and then gradually come above. So suppose you are starting with 2.5 millimeter to 2 millimeter in the first pass, then in the second it should be around 2 to 1.5 millimeters. So it is like you're heating deeper first and then you keep on coming superficial. The intensity to be kept for treating acne scar should be anywhere between 40% to 60%, because it is the duration of the pulse which is more important when we are treating the acne scars. So we want the lateral spread of energy. So we can keep the duration from 300 milliseconds onwards. So 300 milliseconds to 100 milliseconds. Suppose I take a depth of 2.5 millimeters, then I'll keep the duration of the pulse as 300 milliseconds. So you can give multiple pass and give good number of shots. So ideally 600 to 800 shots should be given in a single setting, and you will see very good improvement in the scar texture and even the texture of the skin, lifting, everything. So sometimes we also give around 1,000 shots, whatever the 1,000 shots are there in one single cartridge can be given at a single time. So you can do the face and also the jawline and the upper neck with that. You can preserve the tip if you want, but ideally it is a single use tip. So you should dispose it off once you use it. So certain studies have found out that microneedle depth and RF conduction times are important and not the energy level. So MNRF treated affected also the adnexal structures by coagulating the epithelial and the perifollicular structures. So what happens is this effect is important, because even if your patient has only seborrhea, you can treat that. It's going to reduce the seborrhea and further formation of acne in the patient. Once you are done with the treatment, what can you do? You can either put some salicylate medium, or you can put topical vitamin C, the demelanizing agents of your choice, and hyaluronic acid preparations. Because you're creating micro channels, these mediums, they are going to be delivered much deeper. So if you feel the skin is dark along with the acne scars, you give demelanizing agents. And along with that, you can just use the hyaluronic acid preparation so that the healing is better and the downtime is less. The dryness after the repeated needle prick trauma to the skin helps to resolve much faster when you use hyaluronic acid preparation. So you can combine 2 or 3 together and apply. And post-procedure, what do you see? You see this kind of erythema, which is uniform, and you can see this edema. So this edema is actually making the pores look very prominent. So you just have to tell the patients that's just a temporary effect. The redness and the swelling, whatever is developed, is going to come down within 4 to 6 hours. So they don't have to take a break from their work. They just have to follow good care, good post-treatment routine, which I'll just come through, and then they don't have to have any special precautions or special care that they have to take break and anything. It is just a routine procedure. You can get them treated, and the next day they can go back to their work. When we use higher energies or higher intensities, then we can get these kind of crusting on day 3 to day 4. So crusting is the point of entries of the needle, where large, the higher intensity is given. So this resolves very well when you give hyaluronic acid based creams as post treatment creams. So it hydrates the skin well, the scabs just fall off, and they are not even noticed by the patients. So post-treatment care is not to wash the face for 6 hours. So I told we were putting those adjuvants, and on top of that, you can give a healing cream. I find the KCUT cream very useful. It has vitamin K, it has an SPF of 50, and it hydrates the skin well. And it gives a nice, it reduces the erythema also pretty quickly. So after each and every procedure, we prefer to apply the KCUT cream. So as since we are applying all these things, ask them not to wash for 6 hours. Then strict photo protection. Sometimes because there is no after effects, the patients conveniently forget and they just go out for an outing on Sundays and all. And then because the skin is just rejuvenating, it might cause post-inflammatory hyperpigmentation. They should be advised to use regular and frequently the hyaluronic acid based creams, vitamin C. They should avoid facial scrubbing for at least 5 days and any other cosmetic procedures for a week. And swimming needs to be avoided for at least 2 weeks. The chlorine in the water causes more dryness, and since you all know that in water the sun rays or the ultraviolet light is double because of the reflected light from the water itself and the direct light coming on the face itself. After a treatment of microneedle radiofrequency, it takes 4 days for the full healing of the epidermis, and by 14 days, there is complete skin recovery for all energy levels. So, whatever energies you would have used and whatever would have been the depth of penetration, within 2 weeks, there is complete recovery. And what has been seen that there is marked increase in dermal thickness, dermal collagen, and dermal fibrillin content. There is increased dermal HSP, MMPs, and the extracellular matrix proteins. And increase in dermal fibroblasts are seen at higher energies. So all these is the scientific basis on which we rely for treating the acne scars and also for the skin tightening and the lifting. There are certain studies in Indian patients itself which have been found that microneedle radiofrequency shows significant improvement in the acne scars. Different studies have found that different acne scars have different results. Like in a study, ice pick scar responded best compared to of rolling scars. But on an average, the grade of acne scars and large pores also improved in more than 70% of all patients in this study. So some result or the other we are definitely going to get. So some people might need 2 sessions, some people might need 4 sessions, but there is definitely an improvement in the acne scars and the tightness of the skin after each and every procedure of microneedle radiofrequency. So this is the slide which just shows you the Fraxis Duo system and the energy parameters of the microneedle fractional RF system and the fractional CO2 laser. So we will be discussing about fractional CO2 laser also in the coming slide and how to combine both of them. So these are some of the results. You can see there is significant improvement in the acne scars. So these all you can see it is much improved. So these kind of scars, maybe we need to combine subcision and with microneedle radiofrequency, it will give us pretty good results. So this is our very first cases and we were really impressed with the results. So this is solely treated with microneedle radiofrequency and nothing else. So you can see the depth of the scars has improved in the subsequent sessions. If you see the laxity of the skin here and here and in this third picture is definitely much better. So you can see the improvement in the acne scars as well as there is a tightening of the skin in this. So this is another case where you can see the acne scars have improved and these results are like permanent unless and until you get new acne and new scars or due to some reason, you know, the collagen becomes denatured or if you are like there is solar elastosis and all, unless and until these results are pretty permanent. So you can see a young patient with such varied types of acne scars and almost each and everything is improved with the microneedle radiofrequency. It can be done in presence of active acne also, that it's not a contraindication. Monopolar radiofrequency cannot be done in presence of active acne because that heat will aggravate the acne. In this case, in fact, we can do it on active acne and the acne are going to get reduced by the fractional microneedle radiofrequency. So you can see here there's improvement in the acne as well as improvement in the scars on the forehead. So same patient, you can see on the cheeks and the temple. So this is treated only with microneedle radiofrequency and none other combination was used in this. The most important, in the first couple of slides, I told you about the papular scars. So if you see, these are the papular scars on the chin of this patient, which is very nicely improved with 2 sessions of microneedle radiofrequency. So you can see the acne scars, the open pores. In general, this is very seborrheic skin. So here you know that there is uh, increased activity of the sebaceous glands in this patient. So the acne scars, the oiliness, the open pores, and the papular scars all has improved. And the same time, if you just notice this nasolabial folds, even they seem to be flattened, or the skin here seem to be much better. And similarly, the jawline. So if you see this jawline, this is much better here. So there is lifting of the jawline. So the definition of the jawline is much better here. So similarly, the other side of the chin, you can see the improvement in the acne scars, see the flattening of the nasolabial fold, this mentolabial fold, and also the definition of the jawline. It is very microneedle radiofrequency is also very helpful in these kind of post acne erythematous scars. So sometimes we struggle to treat this, and this is one thing. The post acne erythema is one thing which takes long time to recover. The hyperpigmented scars recur much easily, and they respond to treatment much better than this erythematous scars. So you can see here there are active acne, erythematous scars, and post radio frequency on the subsequent session. Everything is improved very nicely. So this patient was on isotretinoin. So you can do microneedle radio frequency along with isotretinoin. It's not a contraindication. So there is significant improvement, and then the patients are very happy because you can give them such clear skin. The scars are still there, but then still it is much better than what it was earlier. So you can see the improvement in the acne, the erythema, and the acne scars. So here just a case, this was done only for the open pores, and you can see the improvement in the open pores. So you can see in this case, there are active acne, acne scars, and these are the hypopigmented atrophic scars, which was because of earlier intralesional steroid injections given in some hospital. This patient used to get active acne, nodular one, and she used to go to a particular hospital where a nurse would inject intralesional steroid. And subsequently, she got these kind of atrophic scars on the chin and the jawline. When she consulted me for this, I said, I'm not sure what results we are going to get on this, but definitely this is going to improve. Then when we compared the pictures and we saw it's all gone, and she was the one who was so happy. She was not happy that this is gone. She was more happy that these scars of previous atrophic and hypopigmented scars have completely vanished within 2 sessions of microneedle radiofrequency. So microneedle radiofrequency definitely has a strong role in improving this atrophic scars. So you can see here also, the other side also she had similar scars which are totally gone, and the skin is absolutely normal in color. So erythematous acne scars, this is just one single session of microneedle radiofrequency, and you can see the significant improvement in the scars, the erythema, everything. So microneedle radiofrequency is really good in lifting and tightening both. So if you see the nasolabial fold, it is flattened. You can see the mentolabial folds also are much better in this. And you see the acne scars have also improved. So we are delivering everything. And if you can see, this teardrop groove is also a bit better. If not completely gone, it won't go unless we put it, give fillers here. But then if you see, the lip cheek junction is much better in this as compared to this. And this is after 2 sessions of microneedle radiofrequency. So similarly, a older lady with papular scars, acne scars, and these prominent nasolabial grooves. So you can see the improvement in the nasolabial groups and also the improvement in the scars. These are the papular scars being treated. So she had no scars anywhere, but the nose, it was very prominent, and we are still following with her. So this is with couple of sessions of microneedle radio frequency. So here we did it only on the nose, and in this case I preserved the tip. Otherwise the cost becomes too much for the patient. So the tip is preserved and we do the microneedle radio frequency. So you can see that side it was reduced, and here it is almost complete clearance of the papular scars. You can see here nicely. So these are a few of the papers which you can refer to for actually seeing what happens inside. What is the thermal response to fractional microneedle radiofrequency device? So just to give a outline, what was found out that if MNRF delivers energy, so if we give proper intensity and the pulse duration, then only the changes are seen. Just by mechanically delivering the microneedles into the skin doesn't give any improvement. So radio frequency is very important. And when we do the derma roller or the microneedling, so there is only the mechanical stimulation that occurs, and there is no coagulation or the heat generated there. So there's no thermal response if it is only penetrated. So if it is penetrated at a certain level with certain intensity and pulse duration, then only you see the adequate response. And this is another paper which also says that you can combine fractional microneedle radio frequency with subcision. Another paper for atrophic facial acne scars. So there is a lot of evidence also, and once you start doing, you can build up your own evidence with fractional microneedle radiofrequency. There has always been a question, like because microneedle RF is also used as an anti-aging device, can we combine it with fillers? So now there is a paper recently published which says that fractional RF devices which produces significant heat and deeper penetration is definitely going to cause thermal damage to the hyaluronic acid filler. So it is better to do the microneedle radiofrequency treatment first and then put in your filler. Now let's come to the fractional CO2 aspect of Fraxis Duo. So you all know what is fractionated here is the laser beam. So here the laser beam is fractionated using a splitter, and it is delivered through a scanning mechanism. So you can see there is columns of heat delivered and columns of normal skin in between. So this is the microscopic laser puncture, and adjacent to it is the untreated skin. So the new cell regeneration occurs from the untreated skin, and there is remodeling of the skin and improvement in the scars. So the single point wherein the fraction CO2 laser energy is given is called as the micro beam or the micronecrotic columns or the microthermal zones. So if you can see this single dot signifies the area through which the laser energy is given, and the rest of the area is the normal skin. So what is the importance of this microthermal zones? So the number, depth and the size depends upon what fluents we are using, what wavelength, the number of stacks. So in Fraxis Duo there is two ways. You can have a single stack or you can have a double stack. And it also varies from type of machine which are using to deliver the fractional CO2 laser. The density of this microthermal zones is adjustable. So you can decide the density in a particular pattern. Suppose you are your laser light is scanned in a square. So you're planning to deliver the energy in a square shape, then you can decide the number of dots in that particular area. Typically, one microthermal zone is somewhere between 100 to 160 microns. And if you remember, the sites of the the needles in fractional radio frequency were somewhere around 200 to 300 microns. So this is much smaller than that. And these microthermal zones constitute about 15 to 20% of the skin surface area of treatment. So we are just treating 15 to 20% of the skin. Majority of the skin is normal, and that's why the downtime is less and the healing is faster. So when we are treating acne scars with fractional CO2 laser, we have to keep in mind the pulse width or the fluence. So in these pictures, you can see as the fluence is increasing, the dots are becoming bigger and bigger. So it means the total energy delivered will be more, and from non-ablated, it might become ablated. So the other thing we need to keep in mind is the density of the microthermal zones, or also called as the pitch distance. So you can keep it zero point 0.9, zero point 0.8. So that is the distance between the two dots of microthermal zones. So here the pitch distance is more. You can see the pitch distance is 1.2 and the density is 100. So the energy delivered is like this. So when the pitch distance is less, the number of microthermal zones in that particular area will be more. The total energy delivered will be more. If here you see the pitch distance is only 0.3, so the number of microthermal zones are so much that it becomes more of ablative. So you can't overzealously increase the density of the microthermal zones and reduce the pitch distance. Then what will happen? It will be more of ablative, and then you will end up with having more problems of post-inflammatory hyperpigmentation and more downtime, more of scabbing, crusting, and the overlap. So when we are doing, it is better to keep the overlap minimal. If their overlap is more, then what happens? At the same fluence, if you are repeatedly doing on the same area, the depth of penetration is going to be much more. And it also depends upon the scan pattern. In Praxis Duo, the scan pattern is in different types. So you have a scatter mode or scanning from right to left or random. So the scatter mode in this delivers the laser beam haphazardly and it is much lesser in number. So you want to just do superficial rejuvenation or a laser peel, then you can just use the scatter mode with 6 millijoules energy. So what is the advantage of fractional ablative CO2? The microthermal zones are narrow, but the columns are pretty deep. And it not only leads to resurfacing, it also leads to volumetric contraction. So this is the principle which we can use in treating the acne scars with more of open pores. So after doing your microneedle frequency, you can do the superficial fractional CO2 laser in the scatter mode. So how can we use fractional CO2 in treating acne scars? So we can do shouldering of the scar. So you can see here, the margin of the scar is treated with the surgical handpiece of the fractional CO2. It is done in a single pulse mode. You don't want to use it continuously and ablate that area completely. So it is done in a single pulse mode, means the moment you press the trigger or the foot switch, a shot will be fired. And it is done, usually what we prefer is 1 to 1.3 watts. So you do the shouldering of the scars and then rest of the area you can treat the normal scanning pattern of the fractional CO2 laser. And you can combine this with microneedle radio frequency. So you can combine this either after say 1 month, or you can combine it at the same time only. So if you're combining fractional CO2 and MNRF, then first you have to do MNRF because we are treating the deeper part first, and then do the fractional CO2 laser either in the scan pattern or with the shouldering of the scars with a surgical handpiece. So this is fractional CO2 along with the microneedle RF. So if you can see, the erythema is because of the erythema and the edema is because of the microneedle RF treatment done here. And these tiny white dots, if you see, they are because of the fractional CO2 laser done. So here also you can see the dots are scattered randomly. So the energy used can be 6 millijoules to 8 millijoules. Here we just want to have that superficial volumetric contraction so that the open pores respond faster. And this case, we are doing more trauma to the skin, right? It is a bit aggressive treatment. So it is prudent to use epidermal growth factor post-treatment. So immediately after doing this, you are not going to cool this area because you have done laser. So we need that heat, we need that inflammation, what is going on to give us the results. So immediately after the treatment, you put nice epidermal growth factor, and then the healing, the risk of post-inflammatory hyperpigmentation is much reduced and the healing occurs effortlessly. One trick or one tip to minimize the post-inflammatory hyperpigmentation due to the fractional CO2 laser. What happens in India, because of the, we all have a skin of color, so it is usually type 4 to type 6 skin that we deal with. And in south of India, definitely I treat more of type 4 to type 6 skin. So if we select our pitch distance, that is increased pitch distance, lesser density, then there is less chance of PH. And to prevent PH, we can use epidermal growth factor. And if you know that a particular patient is going to, have a chance of developing PH, you can just check the hands and legs for previous trauma, and you can see dark spots there. Then you know that this is the person who has a tendency to develop post-inflammatory hyperpigmentation. So in this case, you can use topical or systemic tranexamic acid. So that prevents post-inflammatory hyperpigmentation to a significant extent. Now, can we combine microneedle radiofrequency and fractional CO2 laser? Yes, of course, yes. So we can combine them either in the same session or on the subsequent sessions. So this is a case wherein we had treated with combination of microneedle RF and fractional CO2 laser at different sessions. So first was microneedle RF, then just a fractional CO2 laser for the resurfacing of the skin, and this is the result what you can see. In this case also, after the first microneedle radiofrequency, if you see, it is a similar case of depressed atrophic scar. It is not hypopigmented, but in this case also, it was because of previous intralesional steroid injection. Now you can see it is completely recovered in this second picture. It is just after one session of microneedle radiofrequency. So these are the combinations. So these are like MNRF done first and then the fractional CO2. So when to do what is always a question. So you have to take into consideration two factors. One, with fractional CO2, the downtime is definitely going to be more than microneedle radiofrequency. So in that case, the patient's availability matters. Suppose the patient has free time and he or she can be indoors and take care properly for a week or more, then you can do the fractional CO2 first. But in case the patient has more of sagging, more of the laxity of the skin, then it is better to do the microneedle radiofrequency treatment first. So when we do microneedle radiofrequency, we'll discuss further that maybe the second session will do is fractional CO2. Just let us know your availability and we can plan the session accordingly. So till date, we have not come across any post-inflammatory hyperpigmentation following fractional CO2 laser on the face. So this is because of the proper timing and good post-treatment care, which is advised and which is made so, it is reinforced to the patient so much so that they don't forget to take care of themselves. So a similar patient, the other side, you can see a lot of depressed scars and the rolling scars, and it is pretty better. So if you compare this picture and this picture, there is significant improvement in the acne scars. These are the papular scars which are treated with combination. The earlier picture I showed was treated only with fractional microneedle radio frequency. Here it is combination done on separate sessions. It is not treated at the same session. So one microneedle radio frequency, one fractional CO2 laser for the volumetric contraction, and then this. So here you see the papular scars are reduced, and then we are treating these kind of open pores and all, and you can see the improvement in the last picture. So again, this is the pre-treatment after one microneedle radio frequency and then the additional fractional CO2 laser. Can we do microneedle radio frequency and fractional CO2 laser on the same time? Yes. As I showed in the earlier picture, when there is too much of these open pores kind of scars and acne scars, then first we do microneedle radio frequency, and then immediately on top of that, the scatter mode fractional CO2. But you have to be careful. I would like to stress that many people try to do this and they land up with post-inflammatory hyperpigmentation. So the most important thing is epidermal growth factor here, if required oral tranexamic acid, and strict photoprotection, and then nothing happens. So here also, if you see, the scars have improved and the open pores have improved. So this is just after one single session. So some people are happy, they decide to discontinue the treatment, I mean, of course, the procedural treatment, and continue only with the topical treatment. So in this case, it was combination of microneedle radiofrequency, fractional CO2, and subcision. All was done at the same time, and this you can see the improvement. So it also depends upon the availability of the patient. If the patient doesn't have time, these days a lot of people travel. So if they have come for a shorter duration of time, then you can't run the sessions at intervals. So you have to deliver the best possible with whatever you have. So then this can be done. So it can be combined. You can do subcision at the same time or at the subsequent sessions. But never forget that subcision is required in many scars, and that is the most basic and the effective treatment we can give to our scars, along with the other technologies, whatever and whichever are available now and whatever would come in the further days. In this case also, so this case, here we have not done things at the same session, they were done at different sessions. So once we have done microneedle radiofrequency and fractional, the other time it was only subcision and the fractional CO2, and you can see the improvement in the scar. So these are the areas, or these are the type of scars wherein you will prefer doing microneedle radiofrequency as well as fractional CO2 laser in the same session, and then you would get good improvement. So this is a slide to show you the histologically what happens. I mean, what is happening, what is the depth we achieve with fractional CO2 and with the microneedle RF. So the depth is very deep, and it is significantly deep in microneedle radiofrequency, and it is pretty superficial in the CO2 laser. So you can show that there is, see that there is intense superficial fibroblast stimulation with fractional CO2, but with microneedle radiofrequency, you have middle and the deeper areas also. So what would be the advantages of microneedle RF in acne scars? It treats both superficial, deep, atrophic, as well as the papular scars. It significantly improves the post-acne inflammatory erythema. It's a color-blind technology, so it is safe in the skin of color. It has minimal downtime. It ablates the hypertrophic sebaceous glands, thereby reducing the further occurrence of active acne and reducing the seborrhea, the oiliness of the skin. It causes tightening as well, improvement in the skin texture. What would be the advantage of the fractional CO2 laser? We can do shouldering of the scars, and there is volumetric contraction of the scars. And with the fractionated technology, we can deliver much narrow columns of thermal energy as compared to the fractional microneedle radiofrequency, and we can easily cover the skip areas with the scatter mode. Now, what is synergism? We might not be able to target or treat each and every thing with fractional microneedle radiofrequency. So if you can see here, the papular scars are responding well to fractional microneedle radiofrequency, but not so with the fractional CO2. We can't do shouldering of the scars, so the bigger scars we can't give the volumetric contraction, so for that we need fractional CO2. We can treat sebaceous hyperplasia with fractional microneedle RF, but we cannot. The deeper with fractional CO2, and the deeper scars can be treated with no risk of PIH with microneedle radiofrequency, and with fractional CO2 there could be always a risk of more risk of PIH. So that's about the presentation. So now just let us have a look at the questions what we have, and we will address one after the other. So the first question is, can we do subcision before the treatment? Is it necessary? Subcision is definitely a most important treatment modality for treating the deeper scars and the scars which are adherent. So when you try to stretch and you feel that the scar is not getting stretched, then definitely yes, subcision is important. It can be done at the same time or it can be done subsequently. So there is no harm in doing it at the same time as well as doing it subsequently. So if you're doing subsequently, it can be like after 15 days or after a month, no problem. And what is the protocol of combination treatment? Well, it depends upon what combination you are using. So as I have been stressing you, if there are acne scars with more of open pores and all, then definitely microneedle radiofrequency and fractional CO2 laser at the same time. With the scatter mode or even the scan mode, no problem, but with lesser energy. So we are just giving 6 millijoules to 8 millijoules and not more than that, because we don't want to damage the epidermis so much that it can give us post-inflammatory hyperpigmentation. That is one thing which, if happens, it's very distressing to the patient as well as the treating clinician. We have given something which the patient never had. So that's why we have to be careful when we are treating. Then epidermal growth factor, hyaluronic acid based creams, strict photoprotection. So these three things which we follow, the downtime is less, the recovery is faster, and the response to the treatment is much, much better. How many sessions of combination treatment are recommended for acne scars treatment? Well, every person differs in their response. So it's like, to give an example, few people are fast learner, few people are slow learners. So similarly, response-wise, few will be quick responders and the others will be slow responders. So on an average, 4 to 6 sessions are required, but we have given beautiful results in some of the patients in one session also, and few require like 6 sessions. Even after 6 sessions, we feel that, oh, something more should be done. So this is the time then you have to put in other treatment modalities like the platelet-rich plasma, and of course we would have already done the microneedle radiofrequency, fractional CO2, and the subcision. Which technology to be used first? Well, there will be always a confusion because you have both. You have when you have fractional CO, you have both. You have fractional CO2 as well as microneedle RF. So what would I use first? So as I told, if there is little bit of SAT, if the patient is older, around 35, 40, then it is always better to, and if there are active pimples, if there is oiliness, then it is always better to do microneedle radiofrequency first, because we are treating the depth, we are treating the sebaceous glands, we are causing tightening and lifting as well. So it is better that we do microneedle radiofrequency first, and then top of it with fractional CO2 if required. What should be the time interval between two treatments? The time interval between two treatments should be anywhere between 4 to 6 weeks. We shouldn't do it before 4 weeks because we are treating it much deeper. So we should give adequate time to show the results and adequate time for the neocollagenesis and the fibroblast proliferation and the remodeling of the skin that is happening. So 1 month interval is convenient for the patients as well, and it sounds more scientific. What are the other treatment indications we can use combination treatment apart from acne scars? Okay, so apart from acne scars, we can use this combination treatment in uh, people with open pores, acanthosis nigricans, laxity of the skin. So these are acne scar indications. So in this case, we can microneedle RF, which will cause tightening, and the fractional CO2 laser mode, I mean the laser peel mode, so which is nothing but the superficial ablation. So that is with 6 millijoules. So that gives a laser peel effect, and it helps in reducing the acanthosis nigricans, reducing the thickness of the skin, and also gives us anti-aging effect, the tightening up of the skin. So, and also in stretch marks. So you can use both MNRF and fractional CO2 in stretch marks, especially the abdominal stretch marks, which happens post delivery. There is a lot of laxity in the scars. So what we do is do microneedle radio frequency. So here the intensity used will be high. So here we won't be using 60%. We'll straight away use 70% of the intensity. The depth of penetration to be 3 to 3.5 millimeters. Then the RF conduction time should be somewhere around 250 to 300 milliseconds. We don't want much of lateral spread here. It has to, because we want the tightening also. And we can do the volumetric contraction with superficial fractional CO2 laser.